We're going to have our regularly scheduled session on arrhythmias and TAVR, T-A-V-R. TAVR stands for transaortic valve replacement. It does not stand for the atrioventricular Rebbe, but he will be here. And that's David Slotwiner, who's the chief of cardiology at NYPQ and a electrophysiologist. Tonight, we really are having a very important session, and we're having it because most of us take a lot of pills, and most of us don't know what we're doing when we take them. Most of you will not eat anything that doesn't have an appropriate hechsher on it. Most of you just take the pills your doctor gives you, or sometimes doesn't. He gives you pills and you don't take them. I actually had a woman come into my office today who has hypothyroidism, and I offered her some Synthroid, levothyroxine, and she said, "I'm not taking that, it causes cancer." So there's a lot of misinformation out there. Dr. Google is not terribly reliable. We have two experts tonight. One of them will talk about antibiotics, and one of them will talk about medications in general. And antibiotics, as you all know, are abused much too much. Well, P.S., I'm going to ask none of you to please do not ask questions while they're speaking. We're doing a video here. We want the video to be uninterrupted. They'll be answering questions afterwards. Our first speaker is going to be George Rodriguez, Dr. George Rodriguez, who's a doctor of pharmacy. He is an assistant professor of pharmacy at the Columbia University School of Nursing. He is the antibiotic expert at our hospital, and since we have a very, very large intravenous outpatient program going on, I'm sure you're very much involved with that. This is all new stuff that you're going to hear about. The days of give me a Z-Pack are over with. Dr. Rodriguez.
Thank you very much. Good evening, everyone. Thank you for inviting me and having me today. So, some of the common questions we get when it comes to antibiotics from our patients. Number one, how do I know if an antibiotic is strong enough? How can I gauge whether the antibiotic will work? What happens if I don't finish my antibiotic? Can I take other medications with my antibiotic, right? Because like Dr. Mill mentioned, you may be taking a lot of other medications. Do they interact? Do they make some of my other medications work less or more? Can I take antibiotics if I'm allergic to penicillin? And then other commonly ones, will the antibiotics stop working if I take them too much? Okay. Now I'm curious, I always ask this when I start, are there any other burning questions that you may have that kind of brought you here today that I could maybe address as we move forward? Feel free to just chime in, because I like to tailor the presentation based on that. Yeah? Okay. All right, so we'll kind of talk about these things. So what is an antibiotic? It's a medication that's used specifically to treat an infection caused by a bacteria. Very important, the last word, bacteria. It's, for the most part, only available via prescription. There are a few antibiotic creams that you can get at the pharmacy over the counter, but for the most part, you can only get antibiotics via prescription after seeing your provider. The antibiotics are available in many formulations, so not just tablets, not just capsules, but they can be intravenous when you come to visit the hospital, or as Dr. Mel mentioned, in our outpatient infusion center. They can be in the form of creams and so forth. And remember, so as I mentioned, antibiotics are used to treat infections caused by bacteria. They do not treat infections caused by viruses. Okay, very, very important. So what is the difference between a bacteria and a virus? So with the naked eye, you could obviously not see the difference. You can't see either, right? They're very microscopic organisms. On the left here we have two photos. On the left we have an image of what we know as Streptococcus. It's a specific type of bacteria that can cause, if anyone's ever had strep throat, this is a particular type of Streptococcus. The difference between the bacteria and virus is bacteria can live on its own, right? So it can infect our body, doesn't require our cells, it can just kind of grow on its own. Not all bacteria can cause harm. So we have many different bacteria that commonly live on our skin, live inside of our GI tract, and they don't necessarily cause harm, but in the right circumstances can. Now viruses typically cause harm. On the right you see an image, again, under microscopic imaging, but it's an image of influenza or a flu virus. Now this requires our human cells to live. Typically, big difference is the viruses, we have less drugs to treat overall when we compare viruses to bacteria, less drugs to treat those. And we do a little bit more of vaccination to prevent the viruses from causing disease. The challenge with a bacteria versus a virus is sometimes, especially in our lower respiratory tract or our lungs, the presentation can be quite similar. So you may present with the same symptoms, but it's hard to differentiate whether it's caused by a bacteria or whether it's caused by a virus. So, pop quiz, does anyone know the first antibiotic ever discovered?
Is that Jim?
What's
What's his name?
That's antibiotic.
Grapefruit guy.
Penicillin.
Penicillin, yeah. So by Sir Alexander Fleming, back, yeah, not very long, 1930s, 40s, right? First antibiotic ever used. We still use this today in the hospital, though quite rare. For the most part, almost all infections that we see are resistant or do not work to this penicillin. We no longer can use it. What are some other commonly used antibiotics that you may have taken in the past or that you know of?
Amoxicillin.
Amoxicillin, yep.
Ampicillin.
Ampicillin,
Erythromycin.
erythromycin, yep.
Tetracycline.
Tetracyclines, excellent. Levofloxacin, azithromycin. All of these are different isins or cillins, right? They're all from different classes of antibiotic. Now, some of them are in the same family. So you mentioned amoxicillin, penicillin, ampicillin. Those are all part of the penicillin class. So if you have an allergy to penicillin, you wouldn't be able to use those other drugs within the class. Bless you. Then you have drugs like azithromycin or erythromycin, different class. You can use it if you have a penicillin allergy. Then we have levofloxacin here on the bottom right, or bottom left, I'm sorry. This drug is in a class of its own. So all different. So the question comes up is there one that's stronger than the other? How can you compare the antibiotics? And really, we don't compare antibiotics as far as strength per se, physically speaking, but we compare them as far as how many different bacteria can they work for, or how many different infections can they work for. And so we have what we term as broad spectrum or narrow spectrum antibiotics. And in general, we try to use the narrowest spectrum because theoretically, if you don't have to use an antibiotic that treats all of these different bacteria, it's better to kind of save it for when the day comes where you may actually need it. Now you can see they come in all different forms, solution, tablets, and so forth. Now why and when do we use antibiotics? Again, you're going to be seen by a provider. They're going to diagnose you with what they've deemed to be a bacterial infection. It can come in the form of a urinary tract infection, a skin infection, lung infection, more serious brain or heart infections. They can be essentially anywhere in our body. And typical signs and symptoms really depend on where it is in our body. So urinary tract infection is one of the most common infections. Could present just as kind of confusion. So maybe you feel a little confused, or you just don't feel yourself, but everything else seems fine. That could be a urinary tract infection. More commonly, though, you'll see burning on urination or a change in frequency on your urinations. And that can all be signs and symptoms, or foul-smelling urine as well could be signs of a urinary tract infection. Skin infections, a little bit easier to diagnose. Usually the skin is red, painful, maybe there's some drainage from the site. And so those are typical. Remember I mentioned we have organisms that live on our skin, typical causes of skin infections. Then you have lung infections. This is probably the hardest, and especially this time of year, between October and March. It's what we call our respiratory season. And so you can have shortness of breath, coughing, wheezing, mucus production, coughing up phlegm. This can be caused by a virus or a bacteria, and sometimes the symptoms are exactly the same. Okay. Now, question. Did you know antibiotics, when used appropriately, can be harmful? Right? So in the hospital, a lot of our teams think that, for the most part, antibiotics are just life-saving, great drugs. But if used inappropriately, they can actually be very harmful. So at least 30% of the antibiotics that are used outpatient, right? So when you go to your doctor's office, 30% have been shown to be unnecessary, meaning that you didn't need them in the first place. Right? When we looked at our emergency department visits for adverse drug events, 1 out of every 5 visits for an adverse drug event was due to an antibiotic. Right? So if you've ever, in the recent months, gone to the emergency department, you know it's not a very joyful experience. You have to wait several hours to be seen. Oftentimes just not fun, you're not feeling well, something you want to avoid, right? And then inappropriate antibiotic use is directly linked to antibiotic resistance, which we'll talk more about in just a second. Okay, so why then, if I mentioned 30% of antibiotics are used inappropriately or unnecessary, why is it that doctors are prescribing antibiotics to those who don't need them, right? I can guarantee you there's no doctor in the world that has a mission just to prescribe antibiotics, right? Their mission is to help the patient. So, for one, your doctor may be concerned that if you get worse, he or she may have a hard time following up with you. And that happens maybe not so much in New York, because healthcare is quite available, doctors are close, but think about in rural Kansas, your doctor's 40 miles away, you see the doctor, they may not be comfortable with you leaving and then perhaps getting sick within the next few days and you can't make it back, right? Some patients actually go to the doctor's office, maybe one of you, who knows, asking for the prescription. So you've actually looked, you've Googled your symptoms, you've come up with what you think is an infection, you think you need an antibiotic, your doctor wants to, again, take the best care for you, also please you, and so when you demand an antibiotic, the doctor may be more likely to give you an antibiotic, right? Even though he or she may feel that you may not need it. And this happens, this has been shown, they've done video recording of patient visits, and they've shown that there's a lot of behavioral aspects to it where patients are very demanding to their doctor. In addition, you may have spoken to a friend or family member or a neighbor that may have had similar symptoms as you. They took an antibiotic and they felt better. But again, remember the presentation can be very similar, and perhaps they had a bacterial infection and you had a viral process. And then lastly, probably the most common is that the doctor may just not have enough information. So sometimes we don't have enough testing or the proper labs, especially if you're seeing on the outpatient side, to truly diagnose. So sometimes the doctor's just using their clinical judgment and then prescribing antibiotics empirically because they just do not know for sure whether or not it's bacterial or viral. So how does the doctor know when to give an antibiotic? The most important thing is going to be the physical exam and your immediate history. So they're going to examine you head to toe, especially if you're complaining of sore throat or shortness of breath. They're going to listen to your lungs, they're going to look into your mouth, and there's a lot of things that they will recognize to help them differentiate whether it's bacterial or whether it's viral. And then they're going to ask you a lot of questions, so it's important to be accurate in your information that you provide. They're going to ask you, when exactly did your symptoms occur? When was your fever? Did you take anything to improve? Did the fever come back? All of this, think of your doctor as an investigator. All of this is helping them kind of determine whether or not they feel you have a bacterial process. There's something that we know is double sickening, which is very important, especially if you're having kind of pulmonary, upper respiratory infections. So let's say today you have a fever, right? You have kind of runny nose, feeling pretty lousy, right? Congested, and then the fever goes away. Maybe 5 days later, the fever comes back. That is something that can be known as double sickening, where the initial presentation was viral, you got better, the body fought the virus, but then a few days later, you had a superimposed bacterial infection. If you don't tell the doctor that, he or she may think this may just be viral because it's very common, but the fact that you've had resolution of fever and then you have it again days later, this is more so pointing towards a bacterial process. And then there are other tests. So has anyone ever been tested for influenza where you've had the nasal swab? Very uncomfortable swab, but very important swab. So it's a nasal swab that goes pretty far back in your nose, can feel very discomforting, but important to diagnose flu. And there are other viruses that can be diagnosed now. We have different, what we call rapid diagnostics or tests that just from the swab in your nose can tell you whether or not there are like 12 or 15 different viruses or bacteria present. And then lastly, the time of the year really helps. Okay, so what are some actions we can take to feel better from a virus? So this is kind of where we're leading to, is that during respiratory season, even with bronchitis, simple coughs, fever, or whatnot, a lot of times it's viral in nature. So instead of kind of relying on the antibiotic, there are things we can do to improve our symptoms. So one, staying well hydrated. When you're febrile, when you're ill, you tend to become dehydrated, so making sure you're drinking plenty of water or soups to replenish your electrolytes. Getting a good amount of sleep. For a sore throat, drinking honey, I'm drinking tea with honey to help relieve that pain. And then we have some over-the-counter medications to kind of help with the other symptoms. So think of antihistamines for when you're runny. So you have a runny nose, you have watery eyes, you have a sore throat, maybe postnasal drip. Think of drugs like Zyrtec or Allegra. These are all antihistamines that you can get over the counter. The generics are just as good. Depending on which store you go to, they may have different generics. And then if you have congestion, this is where it gets kind of difficult. So say if you're congested, you're having trouble breathing through your nose. The drugs that we have available are called decongestants. These drugs can be very harmful. So we don't typically recommend them because they can increase your heart rate. So for those of you who may have high blood pressure or any arrhythmias, this can actually be harmful to you. So if you ever have congestion, we recommend just using saline nasal spray to irrigate your nose, and this kind of helps and does not cause any issues. Okay. So the CDC recently published kind of guidance as to when and when not to use antibiotics during cold and flu season. So obvious times to use, this picture is very small. This is not an eye exam, so I'm not going to ask you to read this first line. But strep throat would be one, whooping cough would be another, urinary tract infections we kind of talked about. But things like sinusitis may not always be caused by a bacteria, or bronchitis is typically caused by viruses. So bronchitis, estimated about 80 to 90% of the time, is caused by a virus. Very interesting, because for the most part, when we've done kind of surveys in the community, many have said that bronchitis equals need for antibiotic, and that may not be the case. Okay. Now, when should we not be using antibiotics? Do not use old antibiotics, right? So I have my fiance here. She took an antibiotic in the past. She became allergic to it, right? And so she stopped using it. So we didn't throw it away at first just because we just forgot, right? But it's not advisable to keep antibiotics. So if for some reason you stop taking the antibiotic, it's best to just discard of it. Don't save it for future use. Don't give it to your friends and family. Just get rid of it. Because what ends up happening is that, yeah, you may be meaning to do the right thing and helping someone out, but perhaps that antibiotic is not for that infection, or maybe they're allergic to that antibiotic, and we do not want to cause harm to anyone. In New York City, I've been told that you can get antibiotics at the local store. Do not do that. Again, you really want to be seen by a physician to really diagnose you, but we've been told that you can get antibiotics from some local stores that can actually get the antibiotics from overseas. And so this is something that may not be the case here, but in maybe some other parts of New York City, that tends to be the case. So why is it bad? Many side effects that this next slide will go over. The most important, antibiotics can lose their ability to work. So we've had patients in the hospital that have had infections that are literally resistant to every antibiotic that we have. It's almost the pre-antibiotic era is what they call it. So imagine before the discovery of penicillin, if you had a wound from war, you basically oftentimes lost that limb because there were no antibiotics to treat that infection. This is the era we're moving to if we don't do the right thing. So there are infections out there, organisms that are resistant to all antibiotics. Antibiotics can interact with the medications you're taking. So if you're diabetic, certain antibiotics can raise your blood glucose level, certain can lower your blood glucose level, and that can really cause issues. Same with other antibiotics or other medications that work for different disease states. And most importantly, it's just a waste of money. If you don't need it, why would you buy it, right? So the typical side effects that we see with antibiotics, GI side effects, so nausea, stomach pain, feeling some vomiting, even diarrhea can be seen. Some of the more severe side effects with drugs like levofloxacin, we can see tendon inflammation, sometimes rupture, especially in the later years of life. Nerve pain can occur, confusion can occur, arrhythmias can occur, all of which can be seen with very common antibiotics that we use. So not to say that you shouldn't use antibiotics, but just like anything else, we want to just use them when we need them. And then something else I'm going to talk about, C. diff can occur. And this is something that's a very severe side effect of antibiotics that can cause severe life-threatening situations. So C. diff is actually a bacteria that many of us have in our GI tract. C. diff, think of it as this kind of purple figure here. This is an organism. Now, a lot of us have this C. diff in our body, and what happens is when you take an antibiotic, we also have good bacteria in our body. And when you take an antibiotic, the antibiotic kills all of our good bacteria and sometimes leaves the C. diff by itself. And when that happens, if you're taking antibiotics for a long period of time, the C. diff tends to replicate, increase in number, and then you have an overgrowth or an overburden of C. diff. And what that can cause is severe inflammation of our GI tract, can cause perforation, it can cause severe diarrhea, and even death. Some of us may have had C. diff in the past. It's a treatable disease, but the problem with C. diff is it often comes back. And so it's very challenging and it's very debilitating to the patients. The risk factors, really prolonged antibiotic use. Certain antibiotics are more likely to cause it. And then older age, just because the fact that our GI tracts may be less inclined to have good health of our normal bacteria. So the difference between C. diff and regular diarrhea is C. diff diarrhea is just a vicious, watery diarrhea that occurs 3 to 5 times a day for at least 3 days, versus your typical diarrhea that you may get from, eating something bad or the antibiotic itself, because antibiotics can cause diarrhea. If you develop diarrhea for that severe for that many days, that is likely to be C. diff, especially if it was after antibiotics, and you should be seen by the doctor immediately. In fact, if you can't be seen by the doctor, you should go straight to the emergency department, because oftentimes you're so dehydrated and it can cause severe consequences. So lastly, I'll finish with antibiotic resistance. Now, again, we can do a better job by not taking antibiotics when we don't need them. Our doctors can do a better job by not prescribing them when they're not needed. But the other thing you can do is, and depending on where you buy your food, make sure that you trust where your food is from, because in the past, not so much now, but there are farms across the country or across the world, probably more accurately, that do not regulate the amount of antibiotics that they give to their animals, and so their animals can become resistant to certain antibiotics, and by consuming those meats, we can then have those same resistant organisms present in our body. So there have been lots of different legislation across the world to kind of prevent this. This was an article back probably 3 years ago, I think, essentially protecting our animals from unnecessary antibiotics. And so just knowing where you're getting your food, where you're eating out, for dinner with your family is very important. And then this was in the Times on Friday. This is a very serious issue. Older Americans are awash in antibiotics. Essentially recapped everything that was just said, and the fact that just antibiotics are great drugs, but let's just use them when needed, because if not, they can cause side effects, can cause drug interactions, and you can lose those drugs in the future. So what can you do as you leave here today? For one, if you're prescribed an antibiotic by your doctor, take the antibiotic, complete the antibiotic. Trust your doctor. If you feel like you can't trust your doctor, perhaps look into getting a new doctor. But if the doctor prescribes it, let's trust them. Do not seek the antibiotic. This is probably the most important. And you may or may not do this, but if you know anyone who does, also give this advice to them. We like to use the internet. We like to self-diagnose. Let's just take the word of our care doctor instead of demanding for the antibiotic. This would really go a long way. Do not save antibiotics for future use, and then do not take antibiotics from friends and family. And then keep in mind that antibiotics are not always the answer. A lot of the things we mentioned can make you feel even better than an antibiotic itself. And then always wash your hands, especially being in New York. That's how you spread infections as well. So C. diff, if you ever develop C. diff is only killed by soap and water. The hand sanitizer can pretty much kill everything else. So if you're on the go, hand sanitizer in your bag is very important. Otherwise, try to wash your hands as much as possible. And that's it. I'd be glad to take any questions at this time.